Hello, I'm Francine, host of Coping to Care, a podcast series sponsored by Blue Sea Care that features guests who share their expertise and life experiences to empower our loved ones in the community. Our aim is to serve as a relevant, genuine, and entertaining resource to help you triumph over the seismic changes resulting from COVID-19. Today, we'd like to welcome Marie Matheson, an experienced doctor with a demonstrated history of working in the mental health care industry. She is skilled in cognitive behavioral therapy, group therapy, family therapy, clinical supervision, and psychological assessment. Welcome, Marie.
Hello, nice to be here.
Oh, great. Now, Marie, what is your strategy for helping people stay healthy when faced with stress and circumstances of today?
Well, first I would like to say that any changes happen when we have changes like we have now. It's important to have a good grounding, and so I would say that to take care of ourselves in a general matter, like taking care of our health through exercise, nutrition, anything that has to do with setting our best asset out is important. And then when we get some problem outside, we are much stronger to assess it and to solve it. So yoga in general has been something that I've been recommending for people for many reasons. First, for physical, because the physical and the mental is related, is one. Through that, we have the meditation that brings stress down. It's vital. The nutrition that people tend to oversee, but it has a huge effect on how we sleep, how we think, on the cortisol level and many other levels that are related to stress as well. I have what do I have? What do I recommend? Meditation, yoga, nutrition, and then one of the things is do passion thing like art. We talk about art, having, if you are that type of person, but each of us as human are creative on some sort. So it's to find an outlet that help us, because when we are, and it can be art, it can be workshop for some people, it can be hobbies. But anything that we get involved with, we have our brain waves that works a certain way and able to readjust on a time of stress. So something like the COVID, where we are kind of stay home, we have to reorient our life and find some level of interest beside work. And it does help us to recenter and I was doing neurofeedback on the past, which I'm not doing anymore, but it's very important. And when you do art, for example, talking about Blue Sea, when we do art, our brain wave go on a certain, after a while, we get like in a kind of meditation through the same brain waves that it does, and bring automatically the threshold down of stress and help us to think better. And if we think better, then our emotions are better managed. And it's a whole spiral, hopefully a positive spiral versus negative spiral when people go through depression or something like that.
Oh, very good. So it's really, really helpful to your mental health to have a good balance of nutrition and exercise and creativity, sounds like. And I understand that you are an artist, a very, very good artist. And so you really must understand how it contributes to wellness. And you've done a few art exhibits. And can you tell me about some of the art exhibits that you've done and how they have helped with resilience and getting through hard times?
Well, yes, actually, I began art. Well, I have done art through building houses, so that was one of my passion. But then it's a lot of money and a lot of time. So I began actually after the last fire, I began to try to do and take lesson into painting. And when I did that, actually, I began to producing, and I got accepted from the Malibu City Hall. They were doing a retrospective after a big fire, to help people that were going through hard times, because they know it's very restorative. So they did like they curated some of the art, and so I have done it. I got accepted, and then they did a second one because so many people, and that's very nice to hear that a lot of people put, their love into something like art after the fire, because it helps them to recenter. And they had so many applications that they had to do a 6 months extra. They redid a second retrospective, and I got accepted with a new piece of art. Again, both of them were related to the fire. He had to be in relation to the fire. And some beautiful art. Some people did gorgeous art. And then after that, they continue with last spring. They continues with the regeneration, because it was the first spring after a year of mourning, basically. And they did that, and so I was accepted again with another piece. So that was. But it's nice. And to see the community helping itself with art, and the city understanding that is very nice, to help them through the difficulty of coping with loss.
Very good. Now, I know that you work with a lot of people who are experiencing depression and different things related to stress and just everyday life. How do you recognize when someone needs help?
Well, first, usually people come to me, or are referred by the doctor or the MD that sends them to me. So that's easy. But then in the room, you can see usually what you have to look, and with the elder population, it's seen as well, because as a society we tend to put them aside. But what's happening is that when we suffer a loss, we tend to withdraw in order to, because our resources are depleted because of a loss, shock, or something like that. And so we tend to withdraw. And so I see a lot of people that are depressive, that are withdrawing. That's a big, big sign. Problem with sleeping is another. And then, yes, no much social interaction, and loss of energy. They tell you they are tired all the time. And so... And so that's a telling sign of usually depression that you have to pay attention to.
And I understand that you were saying how Zoom calls are so much better because you actually get to see the person and understand what they're going through.
Yeah, one of the things that we do as a doctor is you have the person right in front of you. Right now, I'm not seeing anybody on my office, and even if I were, it wouldn't be very, very helpful, because you have to put a mask. So you are losing a lot of signs when you are hiding behind the mask through Zoom. So I have done phone call, but the advantage of Zoom is that the person is much more interactive with you. They see you. On the phone, you don't know what they are doing, if they are distracted by the noise next door or anything, or if they are thinking and doing something else, during that time.
Right.
Whereas on a Zoom, they are right there with you, and you see them, and they are one-on-one, like I'm talking now. And so you are present. And that brings them more into the present, which is when you are depressed, you are not much on the present. Usually you either go toward the fear, the past, or you go toward what's going to happen with anxiety. And so the Zoom helps to see also the person veering or giving you a sign, because they can tell you one thing, but then they not feeling that, and you can pick up with looking at it. So looking at the person, you see a lot of things. You have a lot of, we lose the bottom of the body most of the time, halfway, but it's minimal compared to the facial expression. So Zoom is very important, and if he forces them to interact with you right on one-on-one, which they need. because
Right.
of the withdrawal.
Right. Right. And can you explain? You were talking to me a while back about reframing and what is reframing and how does it work? And you had mentioned something about, seeing the grass as pink instead of green. And so could you go into that? Because that's very interesting.
Well, classically, what we know about psychology is that first we have genetics. We have certain genetics, so we are born a certain way. We're not blank slate. We're born a certain way, and then on top of that, you have the environment from your family that comes on top of that, and based on if it fits or not, the genetic and the parenting, it will enhance the child or not. And so you begin to develop coping mechanism of understanding the world a certain way, the combination of these two things. And so you go in the world which is very subjective, and we go with a belief that the world is the way we see it, and that everybody, you and I and everybody around, sees the world the way I see it. And so what's happening is that if it's a positive way of a positive coping mechanism where thing works for you, then no problem. The problem comes when we begin to develop perspectives that are harmful to our health. And when that happens, it's when we need to change it. And so my idea was taking something about the grass greener, and pink. But the idea is that we believe a certain reality, and through therapy, the person talk and explain how they see the world. I hear that, and I will be able to say and help the person, helping them to see, does he help you or not, based on what you see, and helping them to reframe, what we call reframing, to present them with a different reality. Of course, we don't tell them, but through ways the person comes to see that maybe there is another way, that this green, that pink grass is not pink, but maybe green. And so we entertain that idea and we work with that. And the more you work with it, then after a while, the people begin to accept that that reality is possible and also more conducive to health, and that to try that. And that's when therapy is important as well, because you have to help them branch between the old way that is maybe harmful but comfortable to a new way that is more healthy, or healthier, I should say, but fear, that is brings some fear because they never actually adopted that way. And so even if it's better for them, they don't want to take it, or they are afraid to take it. So as a therapist, you help them to cross that bridge, and you help them practice that perspective. And the more they practice, the more it becomes secondhand and it becomes a reality. And then their health is better. And then now they are on a new spin of, being reinforced by positive outcome.
Mm-hmm. Very interesting. Now, you were talking about something very close to you, and you were talking about a little bit about grief. Can you explain the phases of grief and then your own experience with it? And then maybe go, talk about, you had mentioned that you actually lost your home back in 1993 and that whole story.
Yeah, well, so the classic stages from Dr. Elizabeth Kubler-Ross, it's like a very old classic where it's 5 stages. And so it goes, there are 5 stages. It was a denial, which the denial is about you cannot, it cannot happen to me. It's not possible. It's shock. It's there is no way it could happen, because the reality is so big, particularly here, like losing a house or losing someone, like with all these people losing with the COVID. We cannot accept reality, so we deny it. So that's the first stage. Then the second stage is the anger, because then suddenly we realize the reality, and the realization is very painful. So you have a lot of pain. You have fear. Why me? it's not fair. I mean, all this idea of that anger with, so I lost my house in 93, and the whole, not only me, but the whole, my whole neighborhood. And we had reunion, and it was very interesting because after the denial, denial was done. Now we accepted it because we're all on the same page. You could hear people so angry, and what happened is that you get angry because you feel so helpless. You project it on the outside. So people were angry at the city, people were angry at the fireman, people were angry on all other things. I mean, if they are putting it out because they don't know what to do with that sadness that is unbearable. So that's the second stage, that the anger. I mean, if you lose someone, it may be anger at the medical, the people that didn't take care of themselves. Maybe they get angry at the policy, which some of them they should be right about. But we're not going to go political. Exactly. So the third stage after the denial and the anger, then it's a bargaining, and the bargaining is interesting because it's like you begin, so people who lose someone, well, please, or they're on the process of losing someone, they're going to say, I'll do it. They pray to whatever religion they believe and say, I'll do whatever I need to do in order to have that person not die. I mean, they do whatever they want. And basically, they are trying to arrange things. But usually it's an attempt that is... it's bargaining. I don't know what to say. But it's not accepting. It's like we're still on that process of not yet accepting, and we are dealing and we are beginning to reorganize, but not really. And then depression comes because we cannot. The bargaining didn't work. Usually, it doesn't work unless you have a special ticket. Then what you do is you go on depression because it's so heavy that you begin to feel overwhelmed by all the demand from the outside. So when you lose a house, you have so many things that happen at the same time. When you lose a loved one, there is the loss of not being able to be next to the person and talk. So all this, it's so overwhelming that you begin to withdraw. What I was talking a little bit earlier is like you withdraw from the social, you withdraw from your activities, your daily activity, you withdraw more and more and don't talk to anyone. I just had a patient and she said, well, I just lost a dear friend and I prefer not to talk about it because it's so heavy. And most people do that. I believe I mean, everybody is different. They need some time, sometimes more than others, to deal with their emotion. But the first instinct is to get into ourselves instead of like go outside. And it's interesting because in terms of coping, one of my dissertation, I did it on the people who lost their house. Because I was not doing that, but I lost my whole dissertation on a fire.
Oh, wow.
I know. It was like 5 years of study. And it was a very difficult subject. And it took me a long time. And I tried to go back to it because I had still the idea, but everything was lost. So I tried to go back to it thinking, I knew enough but it was impossible. So I had the whole group of people that burn, and I did it on the people who burn with a coping mechanism and changing what I was doing it on. And so what I discovered is that coping, it's interesting because there is coping sometimes that can be good on some situation and some that are not good on this situation. And one of the big distinction is the outcome. Can you change the outcome by coping? And so sometimes, you can change outcome because you can change your behavior, what we're talking about, and therefore the outcome is positive. But when the outcome cannot be altered because it's something that is greater, like a fire, losing your house or losing a loved one, you cannot change that. They are saying actually that a good coping mechanism is something like humor, because humor which would be disastrous on a other that can be changed, because then it would be more denial. I'm putting the humor, but I'm not altering it. But on something that you cannot change, actually humor is very good. It helps, dealing with it. So then we were in depression. So you deal with that and try things. And then the last stage, finally, you begin to accept the situation.
Acceptance.
You accept your feeling, you reorganize your life. You put life together and begin to see the future and a potential future to start again. And that was actually the last thing of my dissertation, was the rising of the phoenix, because once you are on the bottom, then the only place you have is to go up.
Mm-hmm.
So if you are thinking that way, so
Right.
but yeah. So that's the 5 stage, and so yeah, losing the house was interesting. And so one of the things we talk about is, because I lost the house in '93, I learned a lot. And because I was a therapist as well, I said, well, I didn't lose my house this time, almost, but I didn't lose it. And I said, why don't I have a group of people who lost their house in my home, and I can help them, because I have not only the knowledge of going through it, but I have the professional knowledge as well. So I'm gonna help these people. So I invited these people to like a group of people that lost their house to my home, and we began to meet. And after a while, I began to have some. I began to wake up at night and have some nightmares, and usually I'm pretty good at coping. And I was having all this thing, and I was taking what these people were taking it too close to me, and to the point that I think that I lost track of my professionalism, and went and my past came back. So it's almost, I had this new PTSD that came back. It was 25 years later, but all the image of come, and it was not necessarily of the past of mine, but it was the people, the empathy that I took from the people, but was not able to separate as a professional, like I do with my patient, because it was too close to me. And my arm began to hurt. And I couldn't lift my arm, to the point that I couldn't even wash my hair. I couldn't lift it up. And I had to go see a physical therapist for that. But what happened is, because of course I work on myself to know what was happening. And like I said earlier, with the yoga and meditation, is the body and the mind is only one. We tend to separate it in our world, but we are one thing. So what happened is, I transform the emotional pain in physical, where I couldn't lift. So it was basically, in the image, I couldn't carry these people myself. I couldn't help them. I couldn't lift them. And so I actually give the group to another therapist that was beginning with Temple. And they went with them. And I began to work on myself in order to go back to recenter. And it's basically I recenter and work on myself and did all the things that I'm saying. It was pretty quick, but I was surprised that I was that vulnerable, because it was 25 years earlier, and I never thought that it would come back that quick.
It's just all your empathy that even someone like you, with all that knowledge and education, it just shows how human we are and how fragile we are.
That's right. Yeah. Susceptible and vulnerable. Yeah, I know. And yes, it was very interesting, because I usually I help people and I don't think, and I can push but this one, my body kind of let me know that I couldn't.
So for family members and for seniors, what would you say to them as far as when they should seek help? Because most seniors have the ability to call a psychologist or a psychiatrist. What would you like to say to people out there about the signs, just specific signs to look for, and when they should seek help?
Well, I think when the people begin to say, begin to withdraw from activities, that's the reason what I think what Blue Sea does with the art. I think it's fantastic because it forces these people to be there and engage themselves, not only with the art, but engage with the other people that are around them. So it creates also the social involvement that is very important, because it's looking for withdrawal. It's the same thing when it works for older people, it works for younger people as well, like teenagers, when they begin to withdraw from activities, how they are formulating what they say, the command that they say. If you begin to say, well, one of the things, because of when you're older, you have to pay attention to that because dementia begins to happen at that time. So you need to hear how they say, and not to get overly scared about it, but just to stay alert. Is the person beginning? Because also with dementia, depression comes with dementia as well. Because what's happening when you have dementia, you lose track of things, and you are aware of it, but you are not truly aware. You're aware of things missing, and so you feeling the missing part that are missing. You fill it up with stuff, but it's a filler, and the fear begins to install because they are beginning to aware that they are not in control. And when that loss of control begins to happen, then depression happens for many people. Unless you have been practicing, that thing I'm saying about meditation, yoga, and of, acceptance, that fifth stage, the acceptance of living, accepting to be older with all what it entails. But on our world, we are not teaching older people to accept that. We are still on a youth society. We have to be young. We cannot accept, to get older. We don't, getting older is not a good thing. Some countries do have, like in Japan, it's beautiful how the old age is actually positive, is wisdom and a lot of things. So they are not afraid. It's a normal stage. In America, we tend to say, like, the older people is like, we don't want to go there because we put them on the side. They are not accepted. It's beginning to change a little bit more, but that was a good thing about the COVID that I've seen, actually, the fact of protecting the older people. Of course, he worked for a little while. After that, it was not, but...
Right.
But the idea is, if you see people beginning to voice down ideas, like I'm not hungry anymore. Like the loss of appetite is one, loss of sleeping, and withdrawal, and the cognitive way of expressing themselves, like or stopping taking shower. Now you have to look about why, because it could be because they're afraid of falling. I mean, it could be because they are more frail, so they don't want to do it. But I think the best thing you can do for aging parents is listen. Listen to them and hear what they are saying. And then based on that, indeed, most places, they do provide psychologically, and it is paid by Medicare, Medical, all that is, but because they know that it helps, it makes a better life and it helps people.
Right. Yeah, mentioning the Blue Sea Care art classes, it takes some cognitive skills to be able to log in and get everything working to do the art classes. So that kind of is a good test of their abilities. I see that some of the children are helping them get online to do the art classes. So it is a beautiful thing. So anything else you'd like to add, and possibly maybe do you have a quote that you live by that you'd like to share?
Yeah, well, okay. So one of the things I would like to say that I didn't say, it's like one of the things you can teach people, it's to have empathy to self. Now it sounds like, oh, it's narcissism, but it's not.
No.
It has nothing to do with it, because actually narcissists is the opposite. They have absolutely no empathy for themselves. It's just a makeup and pushing. But when you are going through a hard time, it's being good to yourself. It's like accepting, and that acceptance is like the empathy. So that's something I wanted to add to the recovery, the important thing of the recovery. And that's what you do also when you have like these creative classes. is that everybody is kind of um, supporting each other with the art. Oh, I like it. Show me and things like that. And so it's very positive and very caring, and all that does help and to keep depression at bay. And so my quote, one of the quotes that I like is one from Confucius, so it's pretty old. And it says, it's a classic one, but I love it because I love the idea. It says, I'm not good at quote. I'm always good at,
Oh, you are. You are.
no, I'm not. I have to look at it. Yeah, a journey of 1,000 steps begins by a single step. This is that.
Journey
A
of
journey of 1,000 steps
steps.
begins by a single step. And so that single step can be finding help, you know, and it can be through, help professional. It could be through a program like yours. It can be through friendship and being vulnerable on that friendship and confiding to these people. So you can talk about, if you have something that bothers you or that you're afraid of. And so it's that little step that we allow you to keep going and to see it as a journey versus, just, a step.
Yeah, no, yeah, something to, to get you started. Take that first step. And that's the beginning of the journey. And then probably just step by step, not trying to look from step 1 to step 1,000. Just take it a day at a time.
And that's, I think, is the definition of life. Is that it's a present, living on the present and putting one step on top of. I have actually a movie that I love that is very a comedy. And it goes, What About Bob? Have you ever seen that?
Yes.
I love that movie because it was this person who was like bugging the psychiatrist, and it was like one step at a time. It was it's very fun. If you haven't seen that movie, it's worth seeing again. It was very funny. It's with I'm terrible with names, so I don't remember his name.
But I will definitely look it up. What About Bob?
What About Bob? And it's about that it's very helpless patients with a psychiatrist. And it's very funny.
Oh, good, good. Well, thank you so much for all your wisdom today. It was very, very helpful. And I think that all our listeners will really enjoy it. So thank you so much, Marie.
It was a pleasure.
All right. Well, take care. Thank you.
Bye-bye, Francine.
Bye-bye, Marie.